Hi, my name is Joseph Baughan, and my presentation for the New York presentation is on the future of health systems delivery. So, I think the world keeps changing and changing, and we need to be ready for it. The world's not how it used to be. Our medicine's developed, the way that we look at things has developed, technology has developed, and we need to change with how times are changing. So this article that I read described a way that customers and patients could save more money while industries keep making more money. That's the ideal goal, right? For hospitals to profit and for consumers to not pay as much as they are now because medical bills are extremely high. So the idea here would be for people to telecommute to different types of medical care, such as for checkups would probably be the main target for this. So there would be different apps for patients to use, and they would telecommute to their checkup, and the doctors would give them diagnosis or show them whatever they need to be looked at, and the doctors will help them, which would save a bunch of money, and the patients that can't actually get to the hospitals can still get help without having other people to help them get to the hospitals. Many doctors are already willing to adopt the changes if this will help the progress of people's health. And why wouldn't they? Because they're still making the same money, and the patients are getting maybe even better help because the doctors can patients don't have to show up to the office anymore. So the doctors can be able to help more and more people because they don't have the time of people actually showing up to the office when people are just at home. It's a lot quicker and it's a lot more efficient. This quote from the article that I read from Michael Calagrassi says, at Kaiser's Permanente, 52% of the more than 100 million patient encounters each year are now virtual visits via text messages, calls, emails, or video conferencing. So we're already seeing more and more, even today, of patients virtual visiting instead of showing up to hospitals. 52% is more than half. I mean, that is just one place, but it is showing that people are willing to move on with the times instead of staying complacent in the same space. Also, it makes it easier for people with chronic conditions to visit doctors' offices, and they can just on their cell phone, they can log in different types of stuff that they have, such as if they have diabetes, they can log in their blood levels, their glucose levels, and different things, and doctors can see this, and it's easier to treat it, and it's more time efficient to treat it than it would be for them going all the way to a doctor's office. And when they have the information right there, they can help them more efficiently. This would also allow doctors to check up on patients more often and see if they're doing exactly what they're supposed to be doing, such as taking the right prescription at the right time and making sure that all the things are going along as planned, and making sure that there's no other side effects due to the prescription drugs that they're taking would also be more efficient than going to a doctor's office and doing all of that. According to a direct quote from the article by Michael Gorvasi, already the new telemedicine service has brought the wait time down 90% to an average of 45 minutes. Northwell is increasingly integrating these services to many of its hospitals and centers. Jonathan Merson, master's degree in medical director of the Northwell Emergency Telehospital Hub program, stated, "It's a technological goal that has no boundaries, and the goal is simple. No patient experiencing a behavioral health emergency should have to wait to be seen." Which that I completely agree with this, because there are people that have medical emergencies that need help now. I need advice now, need to know what to do in certain situations. Obviously, if you have a medical emergency, you need to be seen at a hospital so they can actually treat you, if you need help that way. But if it's like a behavioral side effect to something that could be treated over the phone, obviously the wait time is going to be a lot shorter, and it's going to be a lot more efficient for a doctor to help you over the phone rather than driving all the way to a hospital, having them tell you something that they could have told you over the phone. Just save you that whole time. According to the article, Amazon has already kind of adapted what I've just been talking about. Amazon created this new thing called PillPack, which is basically an online pharmacy, and it was developed in Silicon Valley, which basically it allows patients to log in different types of illnesses that they might be experiencing, data, and doctors will give them different type of diagnosis or what they think they might have, and just as much simpler, a lot more cost affecting than it would be to go to a doctor and have to pay all that money just to hear the same exact thing. Also, according to the article, telehealth services could generate up to $10 billion annually over the next few years. Obviously, that doesn't mean you're making $10 million annually right away. That means after a few years that this has already been in place, it could generate up to $10 billion. Then it would be $10 billion annually per year, which that is a lot of money. That's a lot of money to be made for hospitals that could be put to use for patients, for maybe healthcare plans in the future to help cut down cost even more than this already would be, which would be amazing to save people that do not have the money to go to the hospitals, because people don't want to go to the hospitals because they don't have money for it, which is a shame because people need help. People really need help, and telemedicine would be able to help, would be a way to make people that don't want to go to the hospital because they don't want to spend that money. So the Amazon app called PillPack would also incorporate into this, because it would save people money that don't want to spend all that money in the hospital because they don't have it. People that don't have money, they don't want to go to the hospital because it just costs way too much money. So if hospitals are making more money off of this and it's cutting cost of patients because they don't have to go all the way to the hospital, then why wouldn't we want to do this? Why wouldn't we want to cut costs while also raising revenue for hospitals and honestly everything in general? So in closing, I did not know about this previously. I never really thought about this as a way to cut costs and a way to save money and a way to raise revenue for hospitals. But this is something I genuinely think would work and would actually could be put in place, and it has been put in place, and it would make this country a better place. Thank you very much.